Good evening, ma'am. My name is Nasruddin Online. I'm going to be your student nurse for today.
Yes, good evening.
So, may I know what is your name, ma'am?
My name is Sophia Landay,
And your birthday?
April 25, 1982.
Okay. So, for today, I'll be assessing your mouth and throat. And for me to able to assess these parts, I'll be needing to gain your consent if I can touch these certain parts of your mouth. Is
Yeah,
that
sure.
okay?
No problem.
So, rest assured, all of your documentation and findings in this assessment will be completely confidential.
Perfect. Okay.
So the reason that I asked the patient's consent is to gain her trust and cooperation. So I'm just going to prepare the materials that we will need. And can you sit on your most comfortable position? So I position the client to have a better angle in the inspection and to provide her comfort throughout the assessment. I'm gonna perform some hand hygiene now to avoid any contamination between me and you. I'm gonna close this curtain to provide your privacy.
Thank you.
So before we start the assessment, ma'am, I'll be needing to ask you some few questions. Will that be okay?
Okay.
So do you have any discomfort in your mouth or your tongue?
I'm sorry. No, not at all. Sorry
How
about
about
that.
in the back of your throat?
Not that at all.
Okay, that's good. So do you have any problems in your teeth? Any cavities or?
No, but I'm currently wearing a retainers.
Okay, so you have some dentures.
Yes.
Okay, some retainers. How about some sore throats?
No.
That's good. Any surgery including your throat and or in your mouth?
None.
None. Okay, that's
Never had.
dentures. Okay. And your family, does any of your family suffered from mouth or throat problems?
No. Not that I know of.
Okay, that's good. And your lifestyle, are you smoking currently?
No.
No. Okay, that's good. So all of the client's answers will be used as a database for further evaluation. Okay, ma'am. So let's move to the first part of the assessment. But before that, I'll be wearing some gloves. So firstly, ma'am, I'll be inspecting your lips.
Okay.
Open your. Okay. So your lips are pinkish in color. They're also moist and okay. There's
Not
no-
dry.
Yes, that's moist enough. There's also no lesions. Okay. Now I'm gonna inspect your buccal mucosa. Can you open your mouth now? There's no lesions and this is smooth, also moist and pinkish in color.
Thank you.
Good. Now your teeth and gums. So open your mouth.
Sorry.
And that's good. So I noticed that you have some pasta fillings.
Mm-hmm.
I'm gonna count it. So you have a perfectly set of 32 teeth, and it's also symmetric in shape. And Your teeth is symmetric. Okay. And next is palpation of your tongue and ventral surface of your tongue. Okay, so can you stick your tongue out? Stick out your tongue. Okay, so your tongue is moist. There's no lesions. Okay. So I'm gonna touch your tongue. Will that be okay?
Okay.
Stick your tongue again. Okay, there's no lesions. Okay, that's good. So now it's stick it to the roof of your. Okay. Like that. A little bit. Stick to the roof of your tongue. The ventral surface of your tongue is smooth. That's good.
Mhm.
Also moist. There's also no lesions. Okay. Ventral surface. Okay. So now let's inspect your Wharton's duct. Open your mouth now. And the roof of your. Put your tongue in the roof of your mouth. So your relevant is symmetric. There's no lesions and okay, symmetric and no lesions. Again, good. Your Wharton duct is visible. There's also no lesions. And your salivary flow is normal. Okay, that's good. So any discomfort doing that now?
No.
Okay, that's good. So can you stick out your tongue now? I'll be touching again your tongue now. That be okay? Stick your tongue now. Okay. There's no lesions and the veins are visible. That's normal. That's good. Okay. No lesions and veins are visible. Any discomfort? No.
No.
No. Okay, that's good. So let's check the strength of your tongue now. So I'll be putting my fingers in the side of your cheek and you're gonna push your tongue against me.
Like this?
Yes, like that.
Okay.
Now look at me. Okay. Okay. Mm. Mm. Okay. Okay. Mm. So the strength of your tongue is strong. That's good. That's normal. And your anterior. We're gonna check your anterior tongue ability. So I'm gonna let you taste some of this one, and you're gonna distinguish what it is, ma'am.
Okay.
So can you close your eyes? Take your tongue out.
Sugar.
That's sugar. Okay.
Yes.
That's good. And this one.
Salt.
So,
Ah.
okay, that's good. That means.
Ah.
Did you taste that, ma'am?
Ah, yes, I did.
Okay, that's good. That means your anterior tongue ability is strong. It's normal. It's also good. You can classify the taste with the sugar and the salt. Okay. Now let's inspect your hard and soft palate, ma'am. Okay. Can you open your mouth again, ma'am? Open your mouth. Okay. Sorry, sir.
It's okay.
You stick your tongue. Your hard palate is smooth. Okay. And your soft palate is smooth also. There's no lesions.
Mm-hmm.
Okay. And yeah. Okay. Stick your tongue out. Okay. Your gola is symmetric in your soft palate. Okay. Okay, that's good. Let's is pale in color. Okay, that's good. And there's also no infections, and your soft palate is also pinkish, and it's movable also, which is good and normal. And your uvula is symmetric in shape in your soft palate.
Okay.
So next, let's access the uvula. Can you mouth again? The uvula is in the middle. Do you feel any gag reflex now? Like you're going to trouble?
No.
No, no gag reflex? Okay, that's good. No gag reflex. Again, open it. See, okay. So now we're inspecting your tonsils, and your tonsils seems to be there's no swelling or any exudate. And it's enlarged, but there's no exudate or any swelling. So the last part of this one is your posterior perennial walls.
Yeah. Open mouth.
Yes, this is the last. Okay, that's smooth. There seems to be a little amount of bumps there.
Mm-hmm.
Okay, so there's a small amount of lesions, ma'am. I noticed that.
Oh.
But it's also normal and pinkish in color, but a slight lesions. Okay, that's the last part of the assessment. So overall, did you feel any discomfort in it?
No. Everything's fine.
Any gag reflex? Just a little.
A little bit.
Just,
Yeah, just a little bit.
okay, a little bit of gag reflex. That's good. So that's all for this assessment, ma'am. Thank you for your cooperation. Do you have any other questions?
No, thank you.
So overall, your results is normal.
That's good to know.
Yes.
It's good to know. Thank you very much.
Thank you, ma'am. Good evening again, and thank you for your cooperation.
You're
Thank
welcome.
you.